New at 5, Georgia's coronavirus cases are holding steady on the lower end of the spectrum compared to what we've seen over the last 2 years. But that's not the case everywhere. NBC News senior medical correspondent Dr. John Torres joining us live now. Good evening to you, Dr. John. Nice to see you.
It's great to see you as well, Sheba.
Okay, so Dr. John, we're also seeing case numbers rise in children. What are the contributing factors here? What do you think?
And you're right, cases over the last 3 weeks have risen in children, and risen in children a lot more than we thought they would. And there's a couple of things going on here. One is we have this new subvariant, which is different than the subvariant we had just a while ago of Omicron. And this one's the BA 2.12.1, which we know is the most contagious of the subvariants we have here in the U.S. And it's around 30% of the virus in the U.S. right now. And so that can particularly affect children, and that's part of the reason we're seeing it. But on top of that, adult cases are going up nationwide. And when adult cases go up, children's cases go up as well. And one of the concerning things is if you look in other parts of the world, children tend to get hospitalized at a faster rate than they do here. We hope we don't follow suit here and see that happen as well. The main thing is to make sure we protect the children, especially those 5 and under that can't get vaccinated at this point.
Absolutely, that's a good point. You mentioned other countries here, so the subvariant we're seeing here is different to the ones that global researchers are seeing emerge in Africa. What do you know about those?
So there are a couple emerging down here, BA4 and BA5, which again are subvariants of Omicron, but these subvariants are particularly contagious, more so than the ones we have now. But luckily, they don't seem to do any worse with our vaccines than the ones we have out there. In other words, our vaccines are still giving us good protection from severe illness, hospitalizations, and deaths. But we need to keep an eye on that, because if they start changing even more, which is what these viruses do, then we could run into that problem where we end up having more hospitalizations and more serious illness. And so we want to make sure people get vaccinated now, because the more of us that are vaccinated, the less chances we are of having variants, and the more protected we'll all be.
All right, Dr. John, we always enjoy your reporting. Thank you for joining us here.